Hi, I'm Dr. Chin, your aesthetic doctor. Today, let's talk about atrophic scar treatment. So, if you're having this kind of atrophic scar, I personally categorize them into two main groups. The first group will be creating damage, and the second group will be rejuvenating the skin. So, the first group is creating the damage. So, why we need to create damage on the skin is because we would like to use certain methods to destroy the skin in order to let the skin remodeling, and therefore the scar will look much better after the remodeling. There are few methods that we normally use in aesthetic medicine. The first one will be the most common one, laser treatment. So laser treatment also, there are a lot of types. For example, like you have CO2 carbon dioxide laser, you have pico laser, and you have erbium yak laser. All of these laser is create damage in different level of the skin. The second one will be needles. The most conventional type will be the derma roller or derma pen. And now the latest technology, which we have something called micro needling RF. RF stands for radio frequency, which is also used for acne atrophic scar treatment. And the other one will be chemical peel. And we have medium peel, or you have some deep peel, which also can be used to create damage in different level of the skin in order to let the skin to do the remodeling. For example, you have TCA cross, you have a blue peel, and you have a very deep phenol peel. Last and not least, we have something called subcision. Subcision is we use a special needle to cut through the fibrous band under the scar so that the sunken area will be released. For the recovery part, involve a lot of injection. For example, you can inject platelet-rich plasma, PRP, using your own self-growth factor, or you can use some skin booster like PDIN polynucleotide, or some even use biostimulator. If you combine with this group, you might shorten up the recovery time, and also, of course, you're going to get better results. So beside these two common treatment, the last choice for those having severe atrophic scar, which is skin grafting and also surgery. Skin grafting is take part of your skin, maybe from the buttock area, and we put it back to the atrophic scar area, something like cut and paste, to make the hole or to make the atrophic area become less obvious. And the second one, surgical method, is we cut open the scar and we do a suturing to close up the scars. There are some people complain that they don't see any positive result after many sessions of scar treatment. First of all, it's something very, very difficult to get a good result. Second is this personal skin condition. There are some people, their regeneration is very slow. Therefore, after certain damage, they take longer time and they need some help from skin booster to help them to go through this recovery period. For example, people who at their 20s and people who at their 30s. People who at their 30s is always slower in terms of recovery compared to the 20s. So this is also one of the factors that you need to take into consideration when you go through this atrophic scar treatment. And the third one will be, do you get enough damage from those treatment that you go through? So for example, there are people saying that when I go through certain treatment, I get a minimal downtime, which means that or minimal recovery time, which means maybe the damage that is done by those treatment, for example, like laser or the needle, is not enough to create sufficient damage and let your skin to remodeling. Therefore, this also will not give you any good result. So let's say, for example, this patient, he have these multiple types of scars, like rolling scar, he have an ice pick scar, and he have some box scar. If you only choose one type of treatment, I don't think he will get results something like this. So for this kind of patient, I always recommend combination of CO2, pico laser, sometimes even erbium, and also TCA cross, together with this skin booster injection in order to let him recover faster and get a better result. Expectation versus reality. This from is impossible. More or less, you're gonna have some scar shadow even though you went through multiple types of treatment. This is number one fact you must accept. In order to get the best result, you must go through certain downtime. This downtime and all recovery time is the important point to determine that how good is the result from the treatment. If you can accept a downtime for 2 weeks versus somebody can accept a downtime for 3 days, the one that can accept 2 weeks of downtime always get a better result. Why? Because if you can accept more downtime means the doctor can do more damage on your skin, and more damage means there's more skin remodeling, and therefore the result will be better. Is it true if I do one time of treatment, I also can see a very good result? The answer is yes, if you can accept a longer recovery time. So I'm sure some of you, when you search of scar treatment, viral TikTok video regarding a guy, and this guy is go through a very strong acid peel, which is a phenol. This thing create like a chemical burn and burn off the whole skin, and the whole skin will have this full layer of remodeling. His scar is getting so much of improved. But there's a fact that we also must understand. We are Asian. Asian skin, we have one big problem when you have severe damage, which is getting darker. Or we say PIH, post-inflammatory hyperpigmentation. So therefore, for Asian types of skin, you can only go through certain limits of damage in order not to get PIH. Conclusion is, sometimes we need to go through multiple treatment in order to achieve result. My preference for atrophic scar treatment will be determined by what types and how severe your scar is. So if you have a severe scar like this, you need to go through pico laser, CO2 laser, TCA cross, subcision, and skin booster injection. Therefore, if you decide to go for atrophic scar treatment, you need to make sure what type of scar that you are having, how severe your scar is, which type of treatment is the most suitable for you, and which is the combination will give you the best result. Please consult your doctor to make sure that what types of scar that you're having and what types of treatment that the doctor can offer you, and also which is the best combination treatment for your scar issue. For me, combination treatment is always better than a single treatment. So remember, safety comes first, choose the right place, right person, and see you next time.